Good evening, everyone. Thank you for joining us for our webinar this evening on gout. Tonight we're joined by Dr. Philip Robinson for this presentation. But before I hand over to Dr. Robinson, I just want to run through a few housekeeping points just to make sure the webinar runs nice and smoothly for you. So firstly, if you run into any IT issues, just type a message down in that chat box in the bottom left-hand corner of your screen. Someone from Redback who are running this webinar for us will be in touch with you privately. Alternatively, there is that 1-800 number which you might be able to see there in the chat box now. So that's that 1-800-733-416. If for some reason you have a problem so big that you can't get to that chat box, give them a call and they'll do their best to sort it out. Now, if for some reason you do get disconnected, you're unable to stay for the entirety of the webinar, don't worry, it is being recorded and will be made available in the coming days. So if you do have IT issues which force you to become disconnected, we'll be making that available through our usual communication streams in the next couple of days. All right. At the end of this evening's presentation as well, we'll be having a short question and answer section. So throughout the presentation, if you've got any questions, feel free to pop them in that box as well, that chat box down the bottom left-hand corner of the screen. I'll collate them and we'll have a bit of a Q&A with Dr. Robinson at the end. Just bear in mind that that chat box is unprivatized. So whatever's popped in there, people will be able to see it. So if you do have any other questions that you don't necessarily want everyone seeing or you want to keep private, feel free to phone our arthritis information line during our normal office hours of 7:30 till 4, and you can have a chat to one of our health educators. Alternatively, you can email myself at james@arthritis.org.au, and I'll supply you with some of our resources to try to answer those questions. But if you've got something that you would like to ask during the presentation, type it in there and we'll bring it up at the end. And one last thing, at the end of this webinar, you'll be redirected to a short survey. If you wouldn't mind just taking the couple of minutes it takes to finish the survey, it would be a great deal of help. It just helps us make sure our services continue to be relevant to you and that we continue to improve them for you as well. So now I'll hand over to Dr. Robinson. Dr. Robinson is a clinical rheumatologist at Brisbane Rheumatology. He's also a staff specialist at the Royal Brisbane and Women's Hospital, where he runs the gout clinic there. So he's well versed to chat to you tonight about gout. He's also a senior lecturer at the University of Queensland. So without any further ado, I'll hand over to Dr. Robinson to go through tonight's webinar on gout. Thank you, Dr. Robinson.
Thank you very much, James, and thank you very much to Arthritis Queensland for organising this. I think it's a really important topic that often isn't given the importance that it should. So I'm glad that that you guys have organised this to highlight that. Now, I love to start off my presentations on gout by putting up this beautiful picture by James Gilray, which really tries to pictorially describe the symptoms of gout and the severity. And historically, it's been described as one of the most painful things that a human can experience. Obviously, that was from a male perspective, and that perspective is not taken into account childbirth. But look, I don't think anyone with gout would argue that it's an extremely painful thing that they will often do anything to avoid. All right, so if we get started. So the first thing I wanted to talk about was what the symptoms of gout are. Now, this is a picture of the most common joint in the body that gets affected by gout, and this is the first metatarsophalangeal joint, or the joint of your big toe, and most commonly causes swelling and pain, and there's often a lot of skin sensitivity. So it's commonly people would say that I can't actually have anything touching their toe or their joint that's affected. It's so painful. Not even a sheet. And they find that they are almost completely incapacitated from walking in the most acute stages. Classically, it will come on first thing in the morning, so in the early hours of the morning, but not always. And commonly, it also affects the lower limb joints. So we're talking about the ankle, the midfoot, which is sort of halfway between where your toes and your ankle are, and commonly your knee. But essentially every joint in the body is being described to have been affected by gout at one stage or another. And so the lower limb and the big toe are often early ones, and if you have gout or more severe gout, often it will move to other joints later on as gout progresses. So maybe we're getting ahead of ourselves. We need to think about what is actual gout. So we've had a brief coverage of what the symptoms are, but what is actually going on when people get swollen joints that are painful, red and swollen? So it's an inflammatory arthritis and caused by crystals. So if we break that down, we think about inflammation. So inflammation is swelling, and often it's precipitated by the body's immune system and activation. So we bring in immune cells, and so there are lots of causes of inflammatory arthritis, and some of the other ones would include rheumatoid arthritis and psoriatic arthritis, ankylosing spondylitis. And so all of these types of arthritis are inflammatory arthritis, where the body's immune system gets involved and causes swelling and inflammation. But in the different types of arthritis, there's often different causes for it. And so in gout, the cause is urate crystals, or it's also called uric acid crystals. And so these accumulate in the body when the balance between the amount that you make and the amount that you secrete in your urine the balance is disrupted. So you end up either making too much or not excreting enough, and you end up accumulating these uric acid crystals. And they accumulate around joints and often in joints. And, when they sit there, they're often coated, and so the body can't see them, or the body's immune system. But when the body's immune system can see them, they treat them as a foreign body, like a bacteria. And so the immune system will attack them. And that's what's the cause of the swelling and the inflammation, because the immune system is attacking them. So if you have an acute gout attack, what's happening right down on the tiny, tiny level is these crystals are getting attacked and they're trying to be destroyed, but the body can't destroy them, so that means that the swelling and pain continues. So what do these uric acid crystals look like? So I've got a picture here. It's not a high resolution picture, but you can sort of get the picture that these are needle-shaped crystals. And on the next picture, actually, these are just needle-shaped crystals shown under the microscope. And this is another different picture showing the body's immune system as it attacks the crystals. So you can sort of see what happens. So these are what are called neutrophils attacking crystals, and the crystals can't be destroyed by the neutrophils, so they just end up causing this inflammation. So, what causes the crystals to form? So this is sort of the way that I explain it to the patients that I see. I say to patients, imagine that you are a big bathtub, and you're a big bathtub full of urate, and for the purposes of your gout, that's all you are. So urate is sort of a chemical byproduct of a breakdown in DNA. And DNA is in all the cells that we use, and in fact there's been lots of DNA being made and broken down every day, although you don't really appreciate it. And so when you break down DNA, one of the products that's broken down is this uric acid or urate. And so that is not dissolvable in water, and so it has to be excreted. And when the concentration gets too high, you form crystals. So you can see by looking at this diagram that I've got this bathtub with urate there, and it's not quite at the level of gout. And why is that? It's because these are the balances. So there's two things that create uric acid or urate, and one of them is diet. And so diet introduces that, because when you eat meat, you're eating DNA. And the other one is your metabolism. And as I said, you make this all the time. And then you get rid of uric acid through your kidneys and also through your gut. And so there are 4 different mechanisms there, and largely the mechanisms are controlled by genetics. So there's a lot of discussion, especially amongst the public and amongst general practitioners, about the importance of diet in gout. But really, the importance of genetics is stronger. And so when, for example, genetics or diet or any of these influences, for example, when your kidneys don't work so well and you develop kidney failure, when these things don't balance out, the uric acid level or urate rises, and it rises above that line that causes gout. You get crystallization, and then the body starts attacking those crystals. So really, this is just an imbalance in this waste product. So this is a problem that people say is painful. It can cause tophi, which are these collections of uric acid. It's caused by an imbalance. But, what impact does this have? And why is it important? Well, I think it's important because people with gout end up taking more sick leave. They go to the emergency department more. They have much more medical and pharmacy costs than those patients without gout. And it stops people doing the things they enjoy. For example, spending time with their family, going playing sport. And there's certainly a stigma in the community, and I mentioned this, about diet and behaviour. So historically, people with gout were seen to be overindulging in things like food and in alcohol. But certainly, as I mentioned before, that's not a huge, as bigger impact as we understand now, based on things like genetics. And once you get gout, you're more than likely to get it again. So 60% of those who present will present again in a year's time with gout, and if you extend that out to 2 years, it's 80%. So gout is a problem that once you suffer from gout, you're more than likely to continue to have attacks, and it's likely to become a recurrent problem for you. So these are a couple of quotes from a study that was done in New Zealand on gout that sort of tried to assess the impact of this on people. And the impact, this first quote says, "I can't hack the pain. I need to go pay these bills, but if I go to this clinic, no one's going to pay the bills. Or if I hack the pain and go to work. And if I don't hack the pain and don't go to work, my family doesn't eat." So you can see that this person is affected by the symptoms that they're having because they're unable to provide for their family, they're unable to earn the money they need to pay their bills. And this last quote talks about this person unable to do the thing that they really enjoy doing, which is playing rugby. So it really has a huge effect on people that often is minimised. And so making sure that people manage their gout well is one of the things that I think is really important. So one of the other things that's interesting about gout is that it's associated with other things, including heart disease, lipid problems, high blood pressure, and type 2 diabetes. There are more undocumented links with these other things on the lower level, but I think you should concentrate on the things at the upper level. So people with gout have a higher prevalence of heart disease, high lipids, hypertension, which is high blood pressure, and type 2 diabetes. So this is a study that I did looking at a huge group of gout patients and seeing how often they have other problems. So you can see that almost 40% of patients will have high blood pressure and or high or heart disease. So that's 40% is 1 in 2.5 people. So that's more than 1 in 3 people. And then around 1 in 3 people have heart failure, diabetes, and chronic renal impairment or chronic renal disease, where their kidneys don't work as well as they used to. So these are all major health problems that affect people, and it can lead to problems with their health and lead them to die earlier than what they would otherwise. So why is this important? It's important because if you suffer from gout, or one of your friends or loved ones suffers from gout, that may not be the only problem that they have, and that they may have another problem like high blood pressure or diabetes or kidney disease. And so once you have gout, it's really important that you think about these things and you talk to your doctor about your general health. Because when all these things occur together, or you have more than one of these things, it's called the metabolic syndrome. And the metabolic syndrome is when you have things like diabetes and renal impairment and high blood pressure occurring all together. And the metabolic syndrome leads to premature problems with things like heart disease and strokes. So it's important that if you have gout, that you think about these other things, or you talk to your family doctor about making sure that you get screened for them. So is this a common problem, and what's happening? So this is another study that I've done looking at how common gout is. And the Australian Bureau of Statistics measured the prevalence of gout by asking people whether they had gout in a consistent way at least 5 times. And so you can see by looking at this graph that the prevalence has gone from around 0.2%, which is sort of less than 1 in 200, to well up over 1.5%. And that's 1996. So they were talking about 20 years ago now. And I've done another study which then shows that it's up around 2.5% more recently. So you can see that gout is increasing all the time in Australia. And one of the issues is that it's related to obesity or being overweight. So if you're overweight, you're more likely to have gout because being overweight increases your uric acid levels. And it's a common knowledge that Australians and everyone around the world is getting heavier and becoming more overweight. So gout's becoming more and more of a problem. And so we're talking about uric acid and the uric acid imbalance. And so the more imbalance you have, the more likely you are to have gout. So this is the on the left-hand side, this is the annual incidence of gout. And that essentially says how often people develop gout each year. And then uric acid down the bottom. Don't worry about the numbers aren't important. But essentially the graph is the important thing. And essentially it says that the higher your uric acid is, so the more imbalance you have, the more likely you are to suffer from gout. And that goes up, and it's a pretty steep line you can see later on. So so that partially explains why the incidence or how often people have it is increasing, because our serum uric acids are increasing because of obesity or being overweight. So this is the other interesting graph that I've got in the presentation, and that's to look at what happens as you age. So I've got how common it is in the population on the left-hand side. So that's 0 at the bottom and 12%, or 10% there. So that's about 1 in 10 people on the left-hand side. And you can see the ages along the bottom. So you can see that's not very common in people in their 20s. But as people go into their 30s, especially men, the incidence or how often people get it rises. But you can see that it's pretty flat for women until around the age of 50 or 55. And that's because for women who haven't gone through the menopause, they have the estrogen helps get rid of uric acid for them. So that you can see that how often women get gout increases pretty substantially after the menopause, and so that's explained by the lack of estrogen helping them get rid of uric acid. But I was talking about how common this problem is and how much of an issue it is, and you can see that around 1 in 10 men in Australia around the age of 80 or so will suffer from this problem. And now this sort of starts to split out the data a little bit by ethnicity. And so we don't have data in Australia on different ethnicities, but this is data from New Zealand. And this shows the different rates of people have gout between the different ethnicities. So the very top line you can see is the New Zealand Māori, which are the Aboriginal people of New Zealand. And the one below it are Pacific Islanders. And so there are a lot of Pacific Islanders in New Zealand. And so they have extremely high rates of gout, as do the New Zealand Māori. And then if you go down to the next solid black line, that is the total, and then just below it is the Europeans, or sort of white people that originated from the United Kingdom and Western Europe. So you can see that there's a huge difference between, say, Pacific Islanders and Europeans in their incidence of gout. And that is primarily due to genetics and the fact that Pacific Islanders and Māori don't excrete the uric acid from their kidneys as well as Europeans do. So why do some people get gout? Well, I've already touched on a few of these things. Being overweight can contribute to it, and having genes that promote gout. And it's not that they promote gout, it's just that they influence how often or how well you get rid of the uric acid from your body. And then some people can take in foods that can make their gout worse or flare their gout. This is less of a problem, and I think that if you are having problems with gout based on your diet, I believe that you aren't having your gout treated as well as you can. So what diet should gout patients eat? So for almost all gout patients, diet is not enough to manage their disease. And so what do I mean by that? So some people are not keen on taking tablets, and that they want to use a different diet to control their gout, and that's fine. But the answer is that the diet that you need to eat to control your gout is so different from people's normal diet that it's really not enjoyable to eat, and it's often expensive and difficult to get all the things that you need. And it's not enjoyable, and it's a hassle, and it takes a lot of time to prepare. So we have to avoid things with high urate contents, and lots of things including meat, beer, legumes, these sort of things have high urate content. So over the short term, some people can have very low uric acid diets, and they can manage that. But generally over the long term, very, very few people manage to control their gout. And even when people have the very best diet to control their gout, they only make a very small difference to their uric acid. So my next comment is that for almost all patients, they need to be on medication to reduce their uric acid levels, because diet isn't going to be enough to manage it. And for those people who are still having their gout optimized or managed and trying to get their level down, if they have foods that they eat that flare their gout, then I recommend that they avoid these foods. But generally, when I treat patients, I tell them to avoid foods that flare their gout until we're able to get them under control and get that level in that bathtub right down. And once you get that level in that bathtub right down, the vast majority of people are able to eat whatever diet they would like within limits. But there are some foods that have been shown to help reduce uric acid, and here's one of them that is commonly talked about in the public, and that's cherries or cherry juice. But really, as I said, these foods don't really make a big enough difference. You probably need to eat something like, I don't know, 10 or 11 kilos of cherries a day, every day, to manage your gout well. And, you know, you would have no room, and I think you'd struggle to get that many cherries. So, yes, you can eat a few cherries or drink some cherry juice, but you probably aren't going to be able to do that enough to control your gout well enough to avoid taking medications. So what foods are bad for gout? So many people know what flares their gout, and there are lots of different things that can flare people's gout. So commonly things like tomatoes, seafood, beer, people will say that they flare their gout. But essentially, the important thing is that gout's a serious thing, and if you are having recurrent attacks, you need to take it seriously and have appropriate treatment for it. So you can try and avoid the foods that that flare your gout, but inevitably, as I say, often people struggle to stay on a diet that completely controls their gout. So if you're having more than one flare a year, the recommendation is that you should be on medication treatment to lower your uric acid. So how do you treat gout? So we treat gout in two different ways. So as I told you prior, there's inflammation that occurs when the body sees these crystals and they try and destroy them or attack them. And so we need to treat those symptoms of acute attacks with medications that reduce the inflammation. And so that includes anti-inflammatories, and some common anti-inflammatories would be things like Brufen, Voltaren, naproxen, these sort of things. Often you can buy them at low dose over the counter or buy them in the supermarket. And doctors can prescribe higher doses or different anti-inflammatories. Then there are steroids. These are also called prednisone or prednisolone or cortisone. These drugs are very effective at reducing inflammation. And then there's another drug called Gout or colchicine, and this is a drug that's specifically used to treat gout, and it can be very effective, especially if you start early. The other thing that colchicine is very useful is to take regularly to avoid gout flares while we're treating your uric acid. But one of the important things to remember is that treating your gout with just anti-inflammatories doesn't actually get rid of the problem, and the problem is the uric acid crystals. So to do that, you need to lower your uric acid level, and to do that, you need to use drugs that lower that level. And the commonest one that people will use is called allopurinol, and one of its brand names is ProGout. There's another newer one called febuxostat or Uric. But these drugs work in the same way by reducing the production of uric acid in the body, and so you are able to return that balance. And so when you start on a drug that lowers your uric acid, often you'll start on an anti-inflammatory to prevent the flaring of gout. Because when you lower your uric acid, sometimes this can cause you to flare your gout. That doesn't seem very logical, that you're trying to treat your gout and it makes it worse. But when you change the level of uric acid in your blood, sometimes that can cause flares. And so that's why we like to use anti-inflammatory drugs at the same time as drugs that reduce uric acid. So one question I get asked is there a cure for gout? And it depends on really what you define as cure. So I would say that we can cure gout, which is completely take the problem away. But really that's based on the fact that you're treating it with medication. And if you're having recurrent problems with gout and you need to be on medication and your gout is well controlled and you don't have any flares, then you really are required to take the medication long term. So yes, gout can be cured, but it's cured if you take long-term medication. And often people are not keen on taking medication long term, and sometimes they stop. And what happens is their gout recurs, and they just have to go back on it. So I say to patients, well, I know you don't want to be on a medication long term, but if you stay on this medication, then this helps to reduce how often you get gout. And if you're well controlled, then you should never have gout flares as long as you take your medication. So why is it that people still suffer from gout when they are on treatment? They might be on allopurinol, they might be on anti-inflammatories, and they still get gout flares. And this comes down to the fact that often when people are being treated, they're not on enough medication to reduce their uric acid below that dotted line that we saw earlier. So often GPs will start patients on allopurinol medication, but they won't check to see whether you're under that critical line. And so that's why it's really important that if you have gout, that you know what your uric acid level is, and you know what your target is, and you know what the difference between those two things are. And if you're above your target, then you need to increase your medication in conjunction with your GP or your rheumatologist to try and get you below that level. So if you are on treatment and you're still getting flares, then you need to check out what your uric acid level is. So that's called treating to target. And treating to target is really important, because if you're on treatment and you're still getting flares, then you need to treat to target. And so you need to know what your uric acid level is, and the target that we use is either 0.30 or 0.36. And the difference between those two is if you have tophi or not. So if you have tophi, we aim for a lower target, because if we treat you and you have tophi, we like to get rid of your tophi, which we can do over time. But you need to know what your level is, and you need to know what your target is, and whether you're below your target. So I also get asked, what happens if people don't get treatment? And most people don't ask this question because they have so much pain and disability, and they're unable to do the things they like when they have gout. But gout doesn't usually go away. Gout gets more common and gets more problematic. Flares normally become more frequent. Flares are painful and stop you doing what you want to do. But more importantly, flares damage your joints. And what happens when you damage your joints? When you damage your joints, over time you can lose the function that lose your ability to use them. And that's important, because most people want to grow old, and they want to grow old healthy, and they want to grow old and be able to do fun things when they retire, or they want to play with their grandchildren, or they want to do whatever they want to do, and they want to be able to do it well. And so they don't want to damage their joints. So having appropriate good treatment when they have gout when they're younger can help them. Right, so do I need to think about my general health if I have gout? So again, I want to emphasize here, general health is really important that you check these things out. And I've included another one here, including sleep apnea, that's common in patients with gout. And so when people are overweight or obese, they can have problems with sleep apnea, which is when they stop breathing when they sleep. And this can cause problems with high blood pressure and heart disease. So getting a general checkup is a good idea. So what should you do if you have gout that you want to improve? What should you do if you want to treat your gout better? Better gout treatment. So you should ask your GP if you should be on a uric acid lowering drug. And so the rule of thumb should be that if you're getting more than one flare per year, you should probably be on a uric acid lowering drug. And the next important thing to ask is, are you below your target? And if you're not below your target, how can you get below your target? And if you and your GP cannot treat your gout and you're still having problems, you should ask whether it's appropriate to see an arthritis doctor, a rheumatologist. Right, so here's the summary. Gout can be severe, but gout can be treated. You need to make sure that your uric acid target is reached, and you need to think about getting a general health checkup if you have gout. Thank you very much.
Hello. Thank you very much for that, Dr. Robinson. That was very, very like I said at the start, if anyone's got any questions, feel free to type them in there. I have a couple from people who are one of them that was asked a few times, and actually a question I got.
Is that a bit clearer now? Sorry.
Yeah, that's much better. Yep.
Clearer now. Sorry.
There we go. Sorry about that. My microphone was...
There we go. Sorry about that. My microphone was down. Okay. So one of the questions I get a lot through our helpline from people is, why is it that gout tends to affect the big toe predominantly? And can it affect other parts of the body, or is it just the big toe that can be affected?
So we don't actually know why it affects the big toe. Some of the theories is that it's a bit cooler in the big toe compared to the rest of the body, and that affects crystallization of uric acid. So there are chemical properties, including temperature and things like acidity, that changes how things crystallize. And so that may be because of, but the short answer is we don't know why. And to answer your other question, it can really affect any joint in the body. It most commonly affects the big toe to start with, and then the ankle and the middle of the foot and the knee. But really, if you've had gout for a while, it can really be in any joint whatsoever.
Yeah, well, thanks for that. You mentioned a few times the link between some cardiometabolic disease or diseases that affect the heart and our metabolism and gout. Given that the treatments for those usually involve exercise and or physical activity, and similarly a lot of other types of arthritis, one of the key self-management techniques is exercise. What role that exercise plays in gout management, or is there any time that someone with gout should look to avoid exercising, like during a flare or a time like that?
Yeah, so that's a great question. So often when people have gout flares, the last thing they feel like is exercising because it causes pain. So getting appropriate treatment for their flares should help them. Because the primary problem is uric acid, exercise doesn't actually help to lower uric acid unless patients are able to exercise and lose weight. And if they're able to lose weight, then that helps reduce their uric acid. But exercising regularly helps with your cardiovascular health and lowers your blood pressure, and often patients have high blood pressure. So if you have gout, doing regular exercise is a great idea, not just for your gout, but for your general health.
Fantastic. One of the questions that has just come through in our chat box is, how do you distinguish between gout and osteoarthritis? And can you have both at the same time?
Okay, so gout is an inflammatory arthritis, often involved with inflammation, and osteoarthritis is more often a sort of a wear and tear sort of arthritis where you get loss of the cartilage. And so often, but not always, osteoarthritis is not associated with swelling and acute amounts of pain. That settles over a few days, which is really how gout generally acts. You can have both things. Absolutely, you can have both things. And why do you have both things? Well, you've ended up having risk factors or causes for both things. So often if people are overweight, they can develop osteoarthritis due to the load on their joints. And being overweight can increase your uric acid, which can increase your risk of gout as well. So that's one thing that can contribute to both of those problems.
Okay.
But sometimes it's a little bit hard to tell, and sometimes we need to do further tests, for example, blood tests or x-rays or putting a needle into a joint to try and differentiate these things. And that's something that your doctor will do if they're unsure.
Yep. Most people I speak to on our helpline or run into in our community events tend to get the majority of their treatment for any type of arthritis, but particularly gout, through their GP. Is there a tipping point where someone should probably look to see or ask for that rheumatologist referral? And is there anything at a rheumatology level, or at a rheumatologist level, that can be done that may be outside of the scope of a GP, or a little bit of extra help that can be provided?
So if you are getting recurrent gout and your GP is not able to help you reduce that, then that's the time that you should be asking to see an arthritis doctor. Everything that an arthritis doctor or a rheumatologist does, a GP can do, but for historical reasons, there isn't a huge amount of understanding in general practice about the way to treat this well. So there isn't a huge amount of understanding that you need to treat the uric acid to target. And that's because gout has historically thought to be not an important disease that people didn't really emphasize at medical school and afterwards. And so GPs are just often, now there are some really excellent GPs, I'm not saying that it's everyone, but there are a significant number of GPs, and we know this from scientific studies, that don't treat patients to target. And so you might go back to your GP a number of times and they might give recurrent treatments for inflammation and not lower your uric acid. And in that case, you need to be asking about uric acid lowering treatments. And if you're not getting any joy, seeing a different GP or asking to see a rheumatologist.
Fantastic. Well, does anyone online have any more questions at the moment? If not, like I said at the start, our helpline's always available to take calls about gout or any other type of arthritis you might be having trouble with or want more information on. And that helpline number is 1800 041 011. Also, you can also get in contact with us via email, which is just my name, JAMES, @arthritis.org.au. And we can send you, we've got gout resources that we can email or post out to you for free, or we can give you some suggestions on where to go for help as well. Oh, just one more question's come through, Dr. Robinson. Would osteopanadol be sufficient to lessen inflammation?
So osteopanadol is a different strength of Panadol or paracetamol. And that's primarily a pain reliever. It's not an anti-inflammatory. So Panadol might help reduce the pain a little, but it doesn't primarily act on the problem, which is inflammation. It just dulls the pain from the inflammation. So treatments that include the non-steroidal anti-inflammatories like Voltaren, Brufen are much more effective at treating gout flares.
Okay, fantastic. So yeah, if anyone's got another question, feel free to quickly type it in there. Otherwise, I'll just start to wrap things up. But as I mentioned, if you think of anything later, this webinar's been recorded, so it'll be available for you to go back and hear anything that you might have missed if your sound or anything dropped out. And as always, like I've said a few times, any questions, please feel free to call us on that 1800 011 041, and we'll be happy to talk to you about any questions you have for gout or anything else. So again, just to a big thank you to Dr. Robinson for taking the time to come and speak to us this evening. That's been very, very insightful, and I've learned a fair bit as well. I didn't know that there was the association between estrogen and uric acid, and we get a lot of calls on our helpline about who and when people might be at risk. That's helped me a bit in that regard. But I'll just wrap things up from here this evening. Another thank you to Dr. Robinson, and as I mentioned at the start, as you close out of this window, there'll be a quick survey. If you wouldn't mind just filling that out for us, that would be a great help. Thank you very much.
Right. Thank you.